Good afternoon. Thank you for joining us. Today, the Mayor's Office on Women's Policy and Initiatives is taking over today's episode of DC's Health. Let's talk about it to acknowledge that February is, in fact, American Heart Awareness Month. My name is Shatiria Pearson, and I'm excited to be here for important discussions like this. Joining us today, we have Shannon Gopal, who is DC's Health Chronic Disease Division Chief, and Dr. Richard Fernandez, who is the Chief Medical Officer for La Clínica del Pueblo. Welcome and thank you for joining us today to talk about the importance of knowing about cardiovascular heart disease and how we can minimize our risk for developing it in the future. So let's talk about it. The first question is, what is heart disease?
I'll take that one. So heart disease, also known as cardiovascular disease, is a group of problems that occurs when the heart and blood vessels are not functioning as they should. It happens when your heart's blood supply is blocked or interrupted by a buildup of fatty substances in the arteries and can lead to heart attack and stroke. Heart disease is the number one cause of death in the district. We have some 30,000 residents reporting heart disease, stroke, or heart attack. And many of us are either directly affected or know someone directly affected with heart disease.
Wow, those numbers are astonishing. So it sounds like we have some work to do here in the district. So I'll pose this question to you, Dr. Fernandez. What are the major risk factors for heart disease?
Should we all go into? Yeah.
Sure.
So there are many risk factors that can increase a person's chance of getting heart disease. And while some of these cannot be changed, for example, age or history of heart disease, many of these risk factors can be changed. And most district residents, actually over 80% of district residents, have at least one of the risk factors that can be changed. These include high cholesterol, diabetes, high blood pressure, smoking, unhealthy diet, not exercising, overweight and obesity, and too much alcohol use. It's important to be aware of these risk factors because in many cases, heart disease is preventable.
Wow. So I know you just previously named some risk factors for heart disease. Are they the same as symptoms for heart disease and signs?
Well, the symptoms of heart disease are most commonly described as chest pain or pressure. So people will describe an intense squeezing or tightness in the middle of their chest. Sometimes it can be over to the left a little bit, left arm or shoulder. It can also radiate to the neck or jaw, more rarely be felt in the upper back or upper abdomen. And then people will often describe shortness of breath, sometimes break into a sweat or be nauseated. And the symptoms might be intermittent or persistent, depending on the situation.
Okay. So what do you believe or know to believe the correlation between high blood pressure and heart disease?
So high blood pressure is when the pressure inside of the blood vessels is too high. And it's one of the most common causes of heart disease, heart failure. High blood pressure can harden and thicken the arteries, preventing blood flow to and through the heart. And when the heart is not receiving oxygen-rich blood, it begins to weaken and eventually fail.
Okay. So we talked about heart disease. We talked about some symptoms of heart attack. Does heart disease affect women and men differently? And if so, how?
Actually, if you don't mind, I want to go back to some of the symptoms.
Oh, absolutely.
Because I didn't speak about heart attack specifically. So
Okay.
We speak about stable or unstable angina or chest pain, angina being the medical term for chest pain. So stable angina would be a situation where predictably when someone is exerting themselves or doing physical activity, they would feel the pressure, squeezing, tightness, pain in their chest. And then when they rest, it would be relieved. An unstable angina is a more emergency type situation where it could occur at rest or with activity and for an unpredictable duration. If the symptoms are very significant and persist and don't go away, that could signal a heart attack. So usually the heart attack is the same intense chest pressure, but just not going away with rest or other measures that might be prescribed. And in those cases, it's important to seek medical attention immediately.
Okay. And to return to the question, does heart disease affect women and men differently? And if so, how?
Well, the symptoms are generally described in the same way. The symptoms don't differ, although sometimes there's a tendency for women and men to interpret symptoms differently. And certainly their behavior about seeking medical care may differ. So women may occasionally attribute symptoms to stress. Men might attribute chest pain to more musculoskeletal or other factors, but they usually present in the same way. Another difference is that since there is a lower risk for women overall, especially younger women, physicians and patients may be fooled sometimes into thinking that something is not serious when it is.
Okay, so we briefly just discussed the difference or a slight difference between men and women as it pertains to heart disease. But is there a difference between ethnic groups? Who's affected more?
So heart disease can affect people of any gender, race, ethnicity, or age. And in the U.S., it's the leading cause of death among most races and ethnicities. In the district, however, we find that non-Hispanic Black residents are most affected.
Wow. So February is Black History Month. And so can you tell us a little bit more about how heart disease impacts the Black community? I know you briefly stated that while it impacts all residents, non-Hispanic Black people are in the lead as it pertains to heart disease. And if someone doesn't have a heart disease directly, they are impacted by a family member or friend. So could you tell us a little bit more how it impacts?
Sure. So in the district, Black residents are twice as likely to have heart disease than white residents. And Black residents are also more likely to have many of the modifiable or changeable risk factors that I mentioned earlier, including smoking, high cholesterol, high blood pressure, diabetes, obesity, and overweight. And much of these differences in lifestyle factors, we may call them, are historically linked to social and structural barriers that we know have disproportionately impacted Black residents in the district, as well as Black residents across the country. These include racism, food access, education, employment, and housing, just to name a few. And so DC Health, we identify priority populations when we're developing our programming or promoting programming. And so we host lifestyle change programs that are accessible to and in the community. For more information on how to enroll in any of these free lifestyle change programs, please visit livingwell.dc.gov. That's livingwell.dc.gov. We also increase awareness about resources that are available in the community to address many of the social needs or barriers that we know disproportionately, again, impact our Black residents. We believe that by addressing these social needs, eliminating or reducing these barriers will help make the healthy choice the easier choice for residents. And for information on community resources that can help you with nutrition, exercise, or any a range of other social needs, please visit the website linku.findhelp.com. That's LINKU.com. ku.find, FIND, help, HELP.com.
So we have broken down heart disease by gender as well as by ethnic groups. And we've talked a little bit about the social determinants of health and how those are sometimes barriers to heart disease or not having heart disease or lowering the occurrence of the disease. Are there age groups that are affected more by heart disease?
Yes, most definitely. Age is a very strong predictor of heart disease. So the older you get, the higher your risk. Some of that is due to just the fact that as you get older, there's some higher risk of certain other conditions, some of which Shannon mentioned earlier, diabetes, hypertension, etc., chronic kidney disease, and some of these are interrelated, inflammatory diseases, etc. But age, even in and of itself, is a strong predictor of heart disease risk.
Okay. So we talked about the risk. How can we reduce the risk of heart disease?
Well, we've been talking about some of the risk factors that are modifiable.
Yes.
And so, as Shannon mentioned, it's very important to be physically active. Just your ability, your capacity to exercise is a predictor of your longevity or predictor of lower mortality, regardless of your weight and other factors. So being physically active is very important. And I also want to mention that La Clínica del Pueblo, where I work, is putting on our annual walkathon on April 29th. So check out our website, www.lcdp.org, for more information. Beyond physical activity, healthy diet is important. A Mediterranean type diet with healthy fats, fruits and vegetables, nuts is recommended and helpful. Not smoking, not drinking excessive amounts of alcohol. And then also being checked for chronic conditions like blood pressure and diabetes. So you should know what your blood pressure is. You should get it checked at least every 3 years, and or every time you go to the doctor, and your blood sugar as well.
So what I'm hearing is that to find out more about our health, we need to be under the care of a primary care physician. We need to work out a little bit more, eat a little healthier, acknowledging what we are consuming to possibly lower our risk. Mm-hmm. So also, if you guys are interested in working out and exercising, we will be having Mayor Muriel Bowser will be hosting the Her Story 5K on March the 4th, Freedom Plaza. So thank you guys for this plethora of information that you have shared with us, maintaining a healthy heart. We hope that by sharing this knowledge, we can continue to empower our DC residents to make healthy heart choices, to live longer and healthier lives. During American Heart Month, we would also like to encourage you guys to follow us on social media to learn more about how we can take proactive steps to have a better heart. Again, thank you for joining, and see you at DC's Health next. Let's talk about it.